Welcome friends to Broken Narratives. I am your host Jay Firangi coming to you from the Still City, Hamilton, Ontario. As I had mentioned in the last episode, today I will continue with my discussion on COVID-19 lockdown. In the last episode, I had only covered lockdown during the first year of the COVID-19 pandemic, and today I will explore further in the pandemic and bring you more details on lockdown. So, in this fifth episode, you will learn how lockdown measures were declared unlawful in some countries by their high courts and why, number of studies on lockdown effectiveness, including cost benefit analysis of them, more details of collateral damage done by lockdown measures in various parts of the world, and finally, how did Sweden do compared to other countries with less restrictions. So the first clip is of Dr. Bonnie Henry, who has been Provincial Health Officer at the British Columbia Ministry of Health since 2014. And this is from a press conference from March 2021 where she was asked about different crowd size that were allowed in Canada and why that number was different and inconsistent among provinces. And let's hear her response.
So we're moving on to Sandy Hall from CFAX.
Yes, hi. I'm asking a question today about the varying numbers of crowd sizes that have been applied across provinces in Canada. We're getting questions about it. Why is it 5 in Ontario and 50 here? And are we looking at reducing the sizes given that people keep breaking that?
Yeah, so we also had that discussion on our special advisory committee call on Sunday across the country. And, it really is about, right now, all gatherings are off the table. We're all in that place where anytime we get together with more than our household members or our families, we're putting ourselves at risk. And particularly if we're going to be in contact with people who are older and more likely to have severe illness. So when I talk about 50, that's for mass gatherings, for events, for things that are happening in the community. And I am reticent to go, none of these are based on scientific evidence. There's some evidence in that some modeling that Alberta has done that shows that 18, if you have less than 18, your probability of having a case may be less, and so they went with 15. But the bottom line is, none of this really is based on science. It's based on our best effort to ensure that we're not having events like large conferences or groups or church meetings.
So the restrictions that were placed on crowd gatherings, like how many people you can have at your restaurant or gym, how many people you can have at your birthday celebration or marriage ceremony, things like that, they were not based on scientific evidence, as you just heard. Now let's go to second clip, which is from January 2022. This is from the Andrew Lawton show. Andrew Lawton, he is a senior journalist at True North, a news media outlet. He previously hosted a daily talk show on Global News Radio. And these next couple of clips are from his interview with Honorable Brian Peckford, who is a Canadian politician who served as the third Premier of Newfoundland from 1979 to 1989. Brian Peckford had launched a lawsuit against federal government regarding restrictions on interprovincial travel without a proof of vaccine certificate for COVID-19 in Canada. And in this first clip, Andrew Lawton will introduce Brian Peckford and give more details of his political career.
There's a big challenge that was launched this week in federal court by Brian Peckford and other applicants as well. But Brian Peckford is notable because he is the former Premier of Newfoundland. He's also the last surviving of the crafters of the Charter of Rights and Freedoms, of the Constitution Act of 1982. He's the last living of those premiers that were negotiating and adopting in the 1980s and ultimately in 1982, the document that now forms the backbone of Canadian rights and freedoms, or is supposed to anyway. We'll get to that in a little bit. But why this is important is because Brian Peckford is filing a charter challenge. He's saying that the government is ignoring the charter that is the linchpin in his legacy as a premier. I'll let him explain exactly why that is. Brian Peckford joins me now, the Honourable Brian Peckford. It's good to speak to you, sir. Thanks very much for your time today.
Yeah, thank you for having me.
Now, we talked last time. It's nearly 40 years since the Canadian Charter of Rights and Freedoms was adopted, since the Constitution was brought home, as they say, and you're now taking the government to court for violating the very charter in which you were instrumental in passing. Why?
So now let's hear the reasoning and basis for his lawsuit in this next clip.
Section 1, which you mentioned earlier, this is, I'd say, one of the more dangerous sections we've seen in the last 40 years of the Charter, because it's the section that says all of the rights you're about to read are subject to reasonable limits. And the court has, of course, developed a test for that, I know you're going to finish the line, and I want you to do that, but I'm talking about how it's been perceived, because governments have used this as sort of a trump card that they can just say, well, this other thing's more important. And you are right, and I knew where you were going with this. So tell me, why does that not capture the entirety of those Section 1 powers?
Well, number one, Section 1 doesn't apply in my view. As one of the writers of Section 1, it was meant to be in when the country's in a state of peril, insurrection, or war. This is not a state of peril, insurrection, or war. So my number one argument is it doesn't apply, and therefore the unconstitutionality exists. Number two, my argument is, even if you wanted to apply for argument's sake, and that's what you want me to do, engage in an argument on Section 1, you just mentioned, and this is one of the things people perceive it, because it talks about reasonable limits. There are 4 tests. The first one is demonstrably justify what you're doing within reasonable limits by law, all in the context of a free and democratic society. You tell me that the government of Canada or any of the governments of Canada have met any or all of those 4 tests. In the case of the travel ban, they have not demonstrably justified that it's necessary. Where is the report? Where is the cost-benefit analysis? And then free and democratic society means a parliamentary society. That's what Canada stands for, parliamentary democracy. Where are the parliamentary committees? We have 14 parliaments in this country, and none of them have been engaged in any meaningful way in discussing and debating these mandates. And therefore, 2 major conditions of Section 1 have not been met. And therefore, what is happening is unconstitutional. So I think on both counts, 1, it doesn't apply, but if for argument's sake it does, on both counts, the government, in my view, is acting unconstitutional, and that's what we will be arguing before the federal court.
So all the mandates and restrictions that were placed on Canadians during the pandemic were not discussed, and cost-benefit analysis of them were not done in Parliament in Canada, and that was the basis he had launched that lawsuit. But unfortunately, he had lost that lawsuit, I think because of the technical reasons, because he had launched that lawsuit after the restrictions were lifted. I think that was the reason given to dismiss his lawsuit, saying that we don't have restrictions anymore. So that was in Canada. Now let's look at what was going on in some of the European countries. And I have some articles here. First one here is Alliance for Human Research Protection, and this is regarding Germany. German court in Weimar declares lockdown unconstitutional. A landmark legal decision declared that regional containment policies, including lockdowns, social distancing, prohibition on gathering by family or friends, are unconstitutional. The judge called the lockdown a catastrophically wrong political decision with dramatic consequences for almost all areas of people's lives. Forensic analysis of official data convinced the court that the epidemic situation that was used to justify the lockdown laws does not exist. The judge ruled that the government lacked sufficient legal grounds to impose the restrictions since there was no epidemic situation of national importance. He declared that the measures were an attack on the foundation of our society. So this was in Germany. This next article is from the Brussels Time. Belgium must lift all COVID-19 measures within 30 days. Brussels court rules. This was in March 2021. The League of Human Rights had filed the lawsuit several weeks ago and challenged Belgium's system of implementing the measures using ministerial decree, which means it is done without any input from Parliament. Same thing as in Canada. And let's move on. This article is from BBC News. COVID. Spain's top court rules lockdown unconstitutional from July 2021. Spain's Constitutional Court said in a statement that it had voted by a slim majority of 6-5 to find that the state of emergency was not enough to give the restrictions constitutional backing. This is because the rules were equivalent to a suppression of fundamental rights, it said. In order to legally limit people's freedoms to the extent they did last year, the court said the government would have had to declare a state of exception rather than state of emergency. In Spain, the state of emergency, known as state of alarm in Spanish, can be declared by the government and implemented before it is debated in Parliament. This allows the government to put new rules into force quickly. A state of exception, however, is not directly agreed by the government. Instead, the proposal needs to be taken to Parliament first, which then has to declare the emergency. So, this was regarding Spain. One more. No evidence to support COVID lockdown in Scotland during pandemic, says new report. This is from Scottish Daily Express, and this was published in July 2023. The Scottish government's handling of coronavirus is going to be scrutinized by the Scottish COVID Inquiry, which commissioned an independent report on the epidemiology of the virus. Written by Dr. Ashley Croft, consultant public health physician and medical epidemiologist, it will form the basis of discussion during the probe. But he has said there was insufficient evidence, or alternatively no evidence, to support the use of face masks outside healthcare settings, lockdowns, social distancing, and test, stress, and isolate measures in 2020. He adds, the evidence base has not changed materially in the intervening 3 years. And here is a PDF from WHO, World Health Organization Regional Office for Europe, and their guide to revision of National Pandemic Influenza Preparedness Plan. And I want to just give you some details from their plan. This was before COVID-19. So key area 8, non-pharmaceutical public health measure rationale. So here it says, it should be noted that the evidence base for the effectiveness of many NPIs is weak. And a few more details, couple of details. Good practice for effective public health measures in a pandemic. Here they say, the benefit cost ratio and feasibility of NPIs has been calculated and assessed in advance. The legal and ethical ramifications and effects of NPIs have been taken into account in planning, and appropriate risk mitigation strategies have been considered. So this was not done in any of the countries around the world. Risk and benefit and cost ratio was not considered before implementing these restrictions. So now let's look at some of the studies that had come out during the pandemic, and this next clip is from February 2022. This is from Fox News, where they report on a Johns Hopkins study. The study itself was not published by Johns Hopkins, but one of the author was from Johns Hopkins, and which showed that lockdown had reduced COVID mortality rate only by 0.2%. And let's hear that details.
We are getting reaction tonight to a report we told you about yesterday, concluding the coronavirus lockdowns have had little to no effect on mortality during the pandemic. Correspondent Jonathan Seary shows us tonight from Atlanta.
Opponents of mandates are expressing vindication after one of the most trusted sources of data on COVID-19, Johns Hopkins University, published a study concluding that lockdown policies are ill-founded and should be rejected as a pandemic policy instrument. In the Johns Hopkins report, 3 leading economists analyzed data from 24 studies and determined travel bans and mandatory school and business closures early in the pandemic reduced COVID deaths by only 0.2%.
And in this next clip is again from Fox News from March 2022, and you will hear Bhattacharya. He's an American pediatrician. He was formerly the U.S. Assistant Secretary of Health and a 4-star admiral in the U.S. Public Health Service Commission Corps and an acting Food and Drug Administration Commissioner. So in this clip, you will hear him say that lockdowns do not work, and we should not impose mandates and lockdowns when asked by the host.
Admiral Bhattacharya, former White House testing czar, Assistant Health Secretary. Sir, hello to you and good day. We meet again. Are we going backwards?
Well, you know, Tony Fauci always likes to cover all of his bases, so he can't be 100% wrong in the future. But we should not be talking about lockdowns, restrictions, anything with BA2 or any variant we have on the horizon now. We have vaccine immunity, we have natural immunity, we have antibodies, we have oral drugs. We have all this in our armamentarium, and we're in a really good place. Most Americans have immunity. And if you had Omicron, you're certainly immune to the BA2 variant. So we should not be talking about that. Secondly, we now know in retrospect that mandates really don't work. So we don't have the need for them, and they don't really work. So I think Dr. Fauci needs to eliminate this from his vocabulary for the near and long term.
And let's look at some articles regarding effectiveness of lockdowns and restrictions. And this one is from dailymail.com. Johns Hopkins professor blasts his own college and the mainstream media for not publicizing study that found COVID lockdowns only reduced deaths by 0.2% because it doesn't fit their narrative. So as I had said that you cannot find this kind of studies published in many reputable news organization, but Fox News had covered this, and let's hear some details. I will read you some details. Johns Hopkins itself did not even put out a press release about this study, and if you look at the media coverage, it's one of the biggest stories in the world today, and yet certain media outlets have not even covered it, McCary told Fox News host. And I had played a clip from him, Dr. Marty McCary, in the last episode. And let me give you some details. He explained that 60,000 to 70,000 of them died from substance abuse, while others died from deferred cancer care, self-harm, and other side effects of lockdowns. The surgeon also pointed out the number of children who fell behind as schooling moved online. There are hundreds of kids in Baltimore alone that the teachers described never logged on to their virtual learning modules, even ever, he said. So that was part of the finding from that study. And here is an article from Toronto Sun from April 2021. Fury, new Canadian study breaks down ineffectiveness and harms of lockdowns. Lockdowns are accomplishing little benefit, but colossal damage. That's the conclusion of a research paper by Simon Fraser University economics professor Douglas W. Allen, who concludes it is possible that lockdown will go down as one of the greatest peacetime policy failure in Canada's history. Among the 20 studies that did acknowledge the difference between mandatory and voluntary measures, all of them find that mandated lockdowns have only marginal effects and that voluntary changes in behavior explains large part of the changes in cases, transmissions, and deaths. And the one of the most important and biggest indication that lockdowns did harm especially when it comes to Canada. Here is from Statistics Canada, provincial death count and excess mortality, January 2020 to April 2021. And here is the proof. Based on the newly updated provincial database released today from the Canadian Vital Statistics Database, from the end of March 2020 to the beginning of April 2021, an estimated 62,203 deaths were reported among Canadians aged 0 to 64. This represents 5,535 more deaths than expected were there no pandemic. After accounting for changes in the population such as aging, over the same period, 1,380 COVID-19 deaths have been attributed to the same age group, suggesting that the excess mortality is in large part related to other factors such as increases in the numbers of deaths attributed to causes associated with substance use and misuse, including unintentional poisonings and diseases and conditions related to alcohol consumption. So close to 1,500 people had died from substance abuse and alcohol consumption related unintentional accidental poisonings. So this was just from 1 year of lockdowns in Canada, and you heard from the Daily Mail article that in US 60 to 70,000 people had died due to drug overdose and other impact of lockdowns. So if you can see that this happened in developed countries like US and Canada, you can imagine this was also going on in underdeveloped countries and elsewhere as well. So now I'm going to go to Dr. J. Bhattacharya's interview from December 2022, and this is from a podcast from UK, Trigonometry, and in this first clip he will lay out why did lockdown not work, and why could not lockdown work, because it was too late. And let's hear those details.
In April of 2020, I ran a study looking at how extensively the disease had already spread in Santa Clara County, California, where I live, in LA County, and then another study with Major League Baseball all around the country. We found in LA and in Santa Clara was that there was 3 or 4% prevalence of COVID antibodies. So that means that there's a lot of a lot more spread than people had realized. There's like 50 times more infections than cases. That meant the lockdown in April of 2020 meant the lockdown could not work. Like if you're thinking, okay, we do the lockdown, we get to 0, that was gone. And there've been like 100 of these similar studies that have been done since that sort of that verify the same result we found. There are antibody studies, again, from stored blood banks in Europe, in Africa, that find COVID antibodies from stored blood in fall 2019. How did it get there unless someone from China went there? It was too late. By the time we locked down, this disease spread so easily, so fast, and it just doesn't take a ton of contact with the air of people someone's breathing with it, that it was far too late to, if the idea was to get the disease down to 0. Now, if the idea was to get the disease, slow the spread so that we can build hospital capacity and things like that, well, lockdowns failed at that too. We didn't actually build hospital capacity.
So COVID-19 was declared pandemic in March 2020, but as I had discussed in the first episode, the SARS-CoV-2 virus origin episode, that virus was spreading in China in late 2019, in October, November, that period. And as you heard from Dr. J, that they had found samples from Europe and in Africa that they had COVID-19 antibodies towards the end of 2019 as well. So virus was already spreading throughout the world, and by April, when we had imposed lockdowns, it would not stop. It could not stop the spread of the virus. And in this next clip, Dr. J will give details on the impact of lockdowns on poor people around the world compared to wealthy nations in North America.
A lockdown if it's going to work in any, even in any theoretical sense, you basically, what the purpose is to keep people physically apart from each other. Not anywhere in vicinity. If I'm physically apart from you, I can't spread the virus to you. Basic physics, right? But the problem is most people are not in a economic situation that can abide a lockdown. Or even a social situation by a lockdown. It's inhumane, right? So we're actually built to be in community with each other, to talk to each other, to be social, and so that even rich people have that need. But poor people, they need to work in order to feed their families. They need to work they need to be in society in order to have the most basic functions. Many live in poor countries, live in crowded living situations. That's just a fact about the way the world is. You can't have a lockdown. That lockdown will end up impoverishing people. That lockdown will end up throwing people into food, near starvation. That's actually what happened. 100 million people is the estimate thrown into poverty worldwide by the economic dislocation caused by the lockdown. There's one estimate from March of 2021 out of the UN that 230,000 children had died in South Asia alone from the lockdown, the economic dislocation causing starvation by the lockdowns.
And these concerns were not just raised by these scientists, but also raised by WHO itself. And here in this clip, you will hear WHO urging world leaders to not use lockdown as a primary method to reduce the spread of COVID-19.
We in the World Health Organization do not advocate lockdowns as a primary means of control of this virus. Look what's happening to poverty levels. It seems that we may well have a doubling of world poverty by next year.
Now, the World Food Program analysis shows also, due to the coronavirus, that an additional 130 million people could be pushed to the brink of starvation by the end of 2020.
Then we can rather die of coronavirus than to die in our homes of hunger.
We really do appeal to all world leaders. Stop using lockdown as your primary control method.
And let me give you some more details from two articles from United Nations. This one is COVID crisis to push global unemployment over 200 million mark in 2022. We have gone backwards big time, said ILO Director General Guy Ryder. Working poverty is back to 2015 levels. That means that when the 2030 Sustainable Development Agenda was set, we are back to the starting line. The worst affected regions in the first half of 2021 have been Latin America and Caribbean, Europe and Central Asia, all victims of uneven recovery. One more from the United Nations. South Asia, sharp rise in child and maternal deaths due to COVID-19. The report, which covered Afghanistan, Bangladesh, Nepal, India, Pakistan and Sri Lanka, also found that about 420 million children were out of school due to the pandemic and its related control measures. There are also likely to be an additional 3.5 million unintended pregnancies in this region, Mr. Anderson warned. So this kind of harms were being done by lockdowns around the world. And in this next clip, Dr. J will give more details on long-term negative impact of lockdowns around the world.
In Europe, there was a modeling study. It was a really interesting model study. It suggests that 100 million cancer screenings had been skipped. And that's going to lead to 1 million people with later stage cancer that should have been picked up, often will kill them, that shouldn't have killed them. So women will die of breast cancer, stage 2, stage 3, stage 4, that should have been picked up at stage 1. From normal screening that didn't happen. There are like measles cases now, outbreaks in the United States, because people skipped basic immunization. Polio has come back. It was on its way out. We were like this close to eradicating polio. In poor countries, it's even worse, right? In I think Uganda, the estimate is that 4.5 million kids, after 2 years of Zoom school, which is ridiculous in a country like Uganda, they never came back to school. That means it's a generation of poor kids in Uganda will never get an education and will grow up poor. It's just like we fueled inequality in a way that like it's almost unimaginable. And they will lead shorter lives. Even it turns out, like even in rich countries, short interruptions of school has these like long-term negative consequences on the lives of kids, because they grow up poorer.
But their strategy of focus protection was ignored, and they were called a strange scientist, strange epidemiologist. And in this next clip, again, I just want to go through their strategy again, how focus protection would help to protect healthcare workers and hospitals from overcrowding, and how focus protection would help to hospitals and healthcare workers to treat more people.
So I don't think the right thing to do is to do nothing. So if you want to protect hospital systems, you protect older people because that's who that's the highest risk. By doing a focused protection approach, you minimize the risk of the hospitals overcrowding. If instead you do a lockdown, the disease is going to spread anyways, right? Maybe you delay for short time, but not for that long. Like in Toronto, during the earliest lockdowns, the 30 richest neighborhoods saw no case spread. The 30 poorest neighborhoods had enormous outbreak. That was repeated everywhere you saw a lockdown. The lockdown was focused protection of the laptop class instead of focused protection of the vulnerable old, and that's why hospital systems were under stress, because we protected the wrong people.
And Dr. Francis Collins, NIH director, he's retired now, but him and Dr. Anthony Fauci were trying to take down Dr. J and others who had signed the Great Barrington Declaration, and they were emailing each other to put out articles in media that their strategy is very dangerous and more people will die due to their strategy. But in this next clip, you will hear Dr. Francis Collins in July 2023 accepting that their measures they were suggesting were myopic in vision, and they ignored all the harms of lockdowns, and there was enormous collateral damage. Let's hear from Francis Collins accepting their failure.
As a guy living inside the Beltway, feeling the sense of crisis, trying to decide what to do in some situation room in the White House with people who had data that was incomplete, we weren't really thinking about what that would mean to Wilk and his family in Minnesota, 1,000 miles away from where the virus was hitting so hard. We weren't really considering the consequences in communities that were not New York City or some other big city. The public health people, we talked about this earlier, and this is a really important point. If you're a public health person and you're trying to make a decision, you have this very narrow view of what the right decision is, and that is something that will save a life. Doesn't matter what else happens. So you attach infinite value to stopping the disease and saving a life. You attach a zero value to whether this actually totally disrupts people's lives, ruins the economy, and has many kids kept out of school in a way that they never quite recover
collateral
from.
Damage.
So collateral damage. This is a public health mindset, and I think a lot of us involved in trying to make those recommendations had that mindset, and that was really unfortunate. It's another mistake we made.
So he accepted they had made a mistake, but nothing happened to Dr. Francis Collins or Dr. Anthony Fauci. They both have retired, and now they openly go on to this kind of shows, and in interviews they say that they had made mistakes, but they were not questioned or not brought to justice. So now let's see what happened with Sweden. And this next clip is from The Hill, another online news outlet, and this is from August 2023. And you will hear Johan Norberg, who is a Swedish author and historian of ideas, and he will give some background of what was going on in Sweden, how the recommendations were different from other countries in Sweden.
Sweden's controversial pandemic policies have allegedly paid off, according to a new study. As the U.S. and much of the world hunkered down at home due to the coronavirus pandemic, the country, Sweden, had a very different response to COVID that did not include strict lockdowns, mask mandates, and school closures.
Senior fellow at the Cato Institute, Johan Norberg, investigated how the Nordic nation managed, posting on Twitter yesterday, quote, "How did Sweden fare during the pandemic? Back then, the world was shocked by our openness. New York Times called us a cautionary tale. Trump said Sweden is suffering very greatly, but we never heard how it all turned out. Now I've looked, Sweden did better than others." So first, walk us through the decision-making as you understand it in Sweden. Why was there a choice to take such a different approach than much of the rest of the world?
Well, what Swedish authorities said at the time, and the Social Democratic government said at the time, was that Sweden didn't take a strange, unprecedented decision on openness, but other countries took a strange, unprecedented decision to lock down their countries. That was not something that was in the plans for a pandemic. So it seems like the Chinese decision to lock down the economy, put people under house arrest, sort of got people and countries to panic and thinking that this might be the only way to stop the virus, whereas Sweden didn't throw out the manual, but basically stuck to the plan, tried to protect the vulnerable, but keep society, schools, and businesses open.
So governments in North America and rest of the world who were impressed by China that they had stopped the spread of coronavirus in January 2020 by using lockdowns. So here I have a clip from NTD, another news outlet, from August 2021. And in August 2021, China had lockdowns again. So if they had stopped the virus spread in 2020, why would they have to impose lockdowns again in August 2021? And you will also get some details on in terms of how strict lockdowns were in China compared to other countries.
Welcome to China in Focus. I'm Tiffany Meyer. A new wave of the CCP virus is hitting a dozen Chinese provinces. At the same time, more videos are circulating online showing the authorities' extreme control measures, such as sealing residents inside their homes if they don't comply. A video shows a man just a few steps from his home during exercises in the yard with no one else around. But pandemic control officers found him and sent him back inside. They followed him to his door and then sealed it shut. Reports of similarly harsh virus prevention measures are also coming in from the city of Wuhan. An entrance to one neighborhood was welded shut in an attempt to halt virus spread. In one district in Yangzhou City, authorities sealed entrances to entire residential high-rises. The move aims to block virus spread, but also traps residents inside. Videos posted online show residents crying for help inside a building. Locked in, they're unable to leave to buy food, and food deliverers also can't get inside. A similar situation was spotted in central China's Zhengzhou City. There, people were heard yelling, "Save us!" The harsh measure is reminiscent of the lockdowns in Wuhan City last year. At the time, residents trapped inside their homes can also be heard shouting from their windows.
So obviously lockdowns in 2020 in China did not work, and so they had to impose lockdown in August 2021, even after vaccines were available and vaccine mandates were also imposed. And now let's get back to again report from The Hill, and let's hear from Johan Norberg regarding Sweden's response and how there were more deaths at the beginning of the pandemic, but later on it evened out, and towards in the end they did better compared to their neighboring countries and US.
Yes, Sweden did have restrictions and regulations, but not at all to the same extent than that other countries did. It was mostly reliant on recommendations. Try to stay at home, work from a distance if you can do it, avoid public transportation if possible. But there wasn't any kind of government enforcement of those recommendations. But when you look at things like mobility data from our cell phone providers and other things, it seems like Swedes adapted voluntarily almost to the same extent as our European neighbors did. Originally, in the first few months, and that's when New York Times and Donald Trump explained that Sweden was suffering heavily, becoming a pariah state, basically. Yes, Sweden got more of the infections, more deaths than at least many neighboring countries. Then it was what Swedish authorities said that this will even out in the long run because no one can completely avoid social interaction for years. And that's why it's important to look at total mortality, excess deaths above a previous trend. And then what we see remarkably is that Sweden's excess death rate is one of the lowest in Europe, according to some calculations, the lowest in Europe and less than half of America's.
And as I had mentioned before that in US as well, not all states had lockdowns. In the last episode, I had mentioned that Florida was lifting restrictions in late 2020, and Texas was another big state that had lifted mandates in early 2021. So in this next clip, you will hear Dr. Anthony Fauci when asked regarding why Texas was doing better compared to states that had restrictions, because he had predicted that when Texas had lifted their restriction that there will be more cases and hospitalization, and this is a very bad idea. And this is from a Senate hearing when Senator Jim Jordan asked him regarding Texas performance compared to states who did not have restrictions. What Dr. Anthony Fauci had to say regarding that.
You gave us a guess on Texas. Look at the chart here. This is 7-day average of case rate per 100,000 people. You gave us your guess on Texas. You said when Texas ended their lockdown, ended their mandate, that this was, quote, inexplicable and would lead to a surge in cases. Texas is near the bottom of the 50 states, but all the states at the top are lockdown states. So how great was that? That guess didn't seem to be too good. What explains why Texas is so darn low compared to the rest of the states? Lockdown states have a much higher case rate than the state of Texas, which is over a month ago now, said we're not going to lock down, we're not going to have all these mandates that you say we have to have.
Yeah, there's a difference between lockdown and the people obeying the lockdown. You know, you could have a situation where they say we're going to lock down, and yet you have people doing exactly what they want to do.
Is that what is happening in the top 8 states in the country? They're just not following what's been told. They're not listening to Dr. Fauci? Okay, well, Michigan's at 551 cases per 100,000. Texas is at 77. Wisconsin's at 109 because their state Supreme Court overruled their governor, their Republican court, and said we're not going to have a lockdown in Wisconsin. And their numbers are 5 times lower than the state of Michigan, which is right next door.
So according to Dr. Anthony Fauci, he said that it's not about restrictions. It's about people following the restrictions and recommendations. Then why would you impose lockdowns, or why would you recommend, as he was saying in the clip that I had played in the last episode, that he recommended president to lock down the country. And if that doesn't matter, lockdown doesn't matter, it's the behavior that matters, then we should not impose lockdowns. And as you just heard from Johan Norberg from Sweden, that people in Sweden had they were following recommendations from their health officials, and that was good enough to not cause any collateral damage and limit the number of people dying from COVID-19 and limit excess death as well. So that was the my explanation of lockdowns not being based on scientific evidence and all the collateral damage that were ignored. This brings me to the last clip of today's episode. This is a funny clip regarding some restrictions that were placed in US and recommendations that were given by public health officers. And let's hear about tennis balls and what you are supposed to do during the lockdown.
In Long Island, finally, we're going to head over there. A county executive was left this is a red-faced after giving directions on new rules for tennis courts. This poor woman. Take a look.
Every player, unless they're from the same household, has to bring their own tennis balls so that you don't touch other people's tennis balls with your hands. You can kick their balls, but you can't touch them. I'm going to blush, sorry. Of course, if you're playing with someone in your household, you can touch those tennis balls. To avoid confusion between whose balls are whose, you can use a marker, like a Sharpie, to mark out, to put an X or put someone's initials on them.
There you have it. And if you still believe that lockdowns worked and all the mandates, mask mandates and things like that worked, I have a quiz for you. This is a COVID charts quiz. This was done by Tom Woods, and you can take this quiz. They have graphs in graphs they compare states that had restrictions, lockdowns, mask mandates, and states which did not have those mandates and restrictions, and you have to guess which one is which, and let's find out how much you score on that quiz if you still believe that all those mandates, restrictions, lockdowns worked to reduce the spread of the virus and help to reduce deaths from COVID-19. So that brings me to end of this episode on lockdowns, and let me give you a brief summary. There were many countries where their high courts had determined that COVID-19 restrictions on fundamental rights of their citizens were unlawful. There were scientific studies done by various independent organizations and individuals that had concluded that lockdown did little good in terms of saving lives and did more harm all around the world. And public health officers had overstated benefits of these interventions and ignored possible harms of them. And we learned from Swedish experiment, or lack of it, that voluntary measures taken by people based on recommendations from government had produced better results without devastating harm to many. So check out the show notes to verify any of the information, and you can watch the show on YouTube, Rumble, and now on BitChute as well. Subscribe to my channel, please share with others and help me reach more people. With that, I would like to thank you for watching Broken Narratives. I'm your host Jay Firangi, coming to you from the Still City, Hamilton, Ontario, and I will see you in the next episode.